Hello everyone, this video is about diabetes, and today this event is taking place at a Beets farm called Dwight's Beets Farm. Dwight's Beets Farm sounds like diabetes, Dwight's Beets, diabetes. Alright, so let's get started. Let's get started by the two different types of diabetes. One is type 1, which is due to the pancreas not able to produce enough insulin, while the other type 2 is a mixture of that and insulin insensitivity. The body is not able to sense your insulin. So how did I decide to represent that here? So insulin. So this farm right here, the farm, because it is not a regular farm, neither is our host a regular farmer. They don't accept regular IDs or tickets. Actually, to prove that you have registered for this event, you need to have a print of your sole, of your foot sole. So what I mean is, if you write N, like here, N, sole. So to get N, you need the sole, insulin, insulin is the ID. And in the left right here, what is not working is the ID printing station. The ID printing station is the station that produces the insulin, the station that produces those sole bases. So if that is not working, because there are a lot of people, then that is diabetes 1. Now, diabetes 2, what is not working is not that. What is not working is the scanner. What that means is that you do have the insulin, you do have the sole print, but you don't have, your body is not able to detect it. Therefore, it's the sensitivity to it is not there. So what happens is that in type 2 diabetes, you have insulin, but your body is not able to sense it. So that's why here the scanner is out of service. The scanner is out of service. That is type 2. So how to remember which one is associated with what age group? So type 1 diabetes is usually presenting at a younger age, in children as well, and young adults. While type 2 is often associated with increased age, obesity, and sedentary lifestyles, but also it has a lot of genetic component to it as well. So, how are you going to remember that? Well, if you look at this sketch, all you need to know actually is that you know how to count. Because if you know how to count, you know that the number 1 comes before the number 2. So, type 1 comes at a younger age than type 2. Yeah, see what I did there. All right, cool. So let's start by talking about the symptoms of diabetes. The symptoms of diabetes can be remembered with polydipsia, polyuria, polyphagia, which means increased thirst, frequent urination, and increased starvation. So how am I going to remember those? So if you look at the right corner of the image, right here, you have a water tank in this old farm full of holes. This water tank filled with holes, leaking water. I should have expected that at an old Beets farm. Dwight needed to do some renovations. Anyway, so you see all of this water coming out. In this, I made it come out in this particular way. I mean, just to remind you that diabetes is associated with frequent urination, and I think this will serve good to remind you of that. I will leave it here, and then I will see, because of this, no one is able to actually drink water that has not been contaminated with the grass. So all of these individuals right here are extremely thirsty. And you can, another reminder for that, you see the water fountain right here? There is no water. This man right here, I wonder who he looks like. He's also thirsty. All right, and this is diabetes, ladies and gentlemen. And in diabetes, diabetics are also more likely to or more susceptible to fungal infections, and that is because increased glucose it attracts this fungal. And how did I present a fungi? I presented fungi with literally a fun guy. If you look right here at this clown is playing. This clown is a fun guy. Fun guy is fungi. So fungal infections are more likely to occur in the setting of diabetes. Also, there are other symptoms that could be like weight loss, blurred vision, and I didn't represent them here, but you can read more about. Also, there are chronic complications in which I will not cover in this sketch, but just to quickly remind you of some of them. A mnemonic that has been used to remember, actually, some of them is called the knife, and that is like for kidney, retinopathy, neuropathy that occurs in gloves and stocks pattern, and then foot ulcers, and then atherosclerosis, which can cause coronary artery disease, a stroke, etc. And there are and sometimes aspirin is given to prevent that and to decrease the risk. Anyway, I'm not gonna dive into that aspect of diabetes in this video, but I just wanted to cover it to make sure that you're aware of that. So now let's go to the workup of diabetes. How are you gonna diagnose a patient with diabetes? So I decided to do that by these 4 kiosks right here. So how are they gonna help us? So here's the thing. All of these kiosks, what they serve to do is you get a ticket so you can join a race. And they give you 2 tickets so you can do the race twice. Remember this, because in diabetes, when you want to analyze, you want to get when you want to do one of the tests or the screening test, you want to do it twice. After the diagnostic test, you want to do it twice. Anyway, so let's start with one at the left right here. It says fast people go here, 126-meter race. So usually, if you have ever done track and field or watched the Olympics, etc., usually sprinters tend to go for shorter distances, and that is just because. So 126 meters is the fast people go there. So what does fast people mean? Fast for fasting. So you can do fasting plasma glucose. If you get blood glucose over 126 126, 125, etc. In multiple readings, that is fasting. That can be one way you can diagnose diabetes. Also, the next kiosk says random running. Random running to remind you that also random blood glucose can be used, and usually it's when blood glucose taken at any point in time exceeds 200. That is one test, and that is 200-meter race. 200-meter race is random running. Run for everyone. All right. Then 3 is an easy race, because remember, like all those like 4 kiosks go from hard to easy, so or a little bit like more accommodating, so difficulty decreases. So at the left, the hardest test, the fasting people go here, the fasting blood glucose, and then the second, the random blood glucose, the random running, then the third, the 2 hours to complete 200 meters. All right, only 200 meters? Okay, take 2 hours. This is how easy this test is. And you know what makes it easier is that this one you can actually buy you can buy a carb gel, a running gel, only for 75 cents. So why did I make it that way? Is because this test is called the 2-hour postprandial plasma glucose level, and that is after you administer a 75-gram glucose load, and that is more sensitive, by the way, than fasting glucose level, but is not as convenient. So what you want to do is, if blood glucose is over 200 after the 2 hours after the administration of 75 glucose load, that is one criteria, and you can also do it twice. Lastly, this one right here is actually very, very accommodating station. What they say is that this kiosk is for people with back injuries. Back pain, back injuries, Yeah, so people with back pain or individuals aged over 65. What does this mean? If you look closely here, if you look closely at the back sign right here, you can think of it as BA1C. The A1C and the B is to remind you that hemoglobin A1C can also be used for the diagnosis of diabetes. And now, if it exceeds, and why did I say age 65 plus? Because what is the retirement age in the US? It's around 65, 67, 68, etc. You get the idea. So, hemoglobin A1C levels 6.5 or above uh, will meet the criteria for diabetes, but an individual reading is not enough. What you want to do is you want to do also a repeat reading, just like other tests, but in the contrary to other tests, you don't do it the next day. You have to take a 3 month in between them. So I made this individual right here say, I will take a 3 month break. This race sucked, honestly. It's a tough race. I'm injured, my back hurts. So now I'll take a 3 month break. Wow, very generous. And that is a good way to remember that hemoglobin A1C levels of 6.5 or above need to be repeated in 3 months. And if that's the case, if two readings come back, then you have diagnosis of diabetes. All right. So now we have talked about diabetes types, pathophys, and diagnosis and symptoms as well. Let me just quickly brief talk about treatment, and I will not dive deeper in the specifics of different diabetic treatments. But diabetes, depending on the type, different treatment. Type 1, mostly its treatment is insulin, subcutaneous injections. It can be basal bolus. Basal bolus, you give long acting with mealtime insulin. But type 2, the first line actually is lifestyle modifications, especially for obese patients or those with a sedentary lifestyle, medication, exercise, and also change of habits like smoking, etc. Can help with minimizing certain complications like vascular complications. But if that is not sufficient, you want to give non-insulins. You can you want to give pharmacological treatment. And the pharmacological treatment for diabetes, there are two types: insulins and non-insulins. So for mild to moderate diabetes, and that what I mean is, like, if you have diabetes, fasting blood glucose from 140 to 250, and one hemoglobin one AC no sorry A1C less than 9, then or lower, then you can give non-insulin medications. And the first line is metformin. Metformin, how did I decide to represent it here? If you look at the top left of this image right here, there are the Ninja Turtles meet and greet session. Wow. All right. So Dwight took care of his guest, and now he brought the Ninja Turtles as well. So kids go get their signature. And how is this related to metformin? How many Ninja Turtles are there? 4. This sketch only has 3, but the Ninja Turtles are 4, not 3. And if you don't know that, well, I mean, sorry, I'm not sure what to say. But yeah, so meet and greet, met for Ninja Turtles. Ninja Turtles are men, so met for men. Met for men. Met for men. Say it quickly, and you know what it sounds like? For men. Yeah. Anyway, so that is the first line therapy. Now, if it is not enough, what are you going to do? You're going to add a second medication of a different class. And there are multiple classes of non-insulin antidiabetics. They include the SGL2 inhibitors, the GLB-1 agonists, the glinides, etc. Sulfonylureas, and there are multiple ones, and there are specific indications for one. There are ones that are associated that are not given in congestive heart failure, and others that are better, etc. GLB-1 agonists help with weight loss. So those indications, I'm not gonna dive them into this video for time's sake, but I want to be aware that once you make that choice, there are certain considerations based on the particular patient that you want to consider before prescribing a second medication. Now, let's say you have tried lifestyle medications. Let's say you have tried those non-insulins and you still have not controlled diabetes. What would you do? Then you would go to insulins. You would get to insulins, and insulins for type 2, you will give basal long-acting insulin. And there are multiple types like glargine, and there are multiple ones. And then you can, as needed, add bolus as well. But I'm also not going to dive deep in that. But I just want to remind you that the main difference in given insulins versus non-insulins and the factors you should consider is that if the disease is mild, you can use the non-insulins or moderate. But if the disease is severe, for example, you have fasting glucose over 250 or hemoglobin A1C over 9, then insulin is the choice you want to go with. All right. Thank you so much.